At the Lakeland Capsule Weight Loss Center, we try to basically teach or reteach, re-educate people on appropriate lifestyle and exercise and good health. There's a lot of misconceptions and fallacies about being heavy and how to correct the problem. I probably think that just surgery, most people say it's the easy way out. It's actually the most difficult way out. Weight loss surgery is nothing really more than a tool or an instrument to help you change your behavior. If they eat too much, they eat too fast, or sometimes with some average, if they eat the wrong foods, they will get sick, they'll get pain, they'll vomit, they'll have diarrhea. So again, it's not the easy way out. We treat every patient as a unique individual. I think that's the part where most weight loss programs fall off. Everybody has their own problem a little different than the next person. Yeah, there's some generalities of society that we fall into as a group, but all of us do things differently. And my problem for my obesity is different than some of my patients may be. And so we try to identify those problems individually and help them address and face those problems head on. We don't understand how badly the disease of obesity affects us. So right now in America, about 75% of us are overweight, and about 30% or maybe even 35% are obese. We see almost 250,000 children, these are kids under the age of 12 with diabetes, related to the food they eat. This is something that should not be ignored. It's as bad as the deficit is nowadays. If we don't fix the problem now, our future is very bleak, our future is very grim. It has to get better. I think if we pick first on our children, which is a good place to start, because they are our future, that's really my passion today, is helping educate, actually it goes by being a role model too, living the life. But we need to do better than we are doing. The numbers are getting just mortified. They're terrible. And we need to improve on what we're doing here at Lakeland as well as across the rest of this country too.
I decided to undergo bariatric surgery because I had found that trying to use my own willpower and trying to use diets and so forth just weren't succeeding for me. And I had heard that bariatric surgery had had a lot of success. So I decided I needed to do something because I was suffering from a lot of weight-related problems. I was having joint problems, I was having health problems, and it was time for me to do something. I decided to use Lakeland because I'm very familiar with Lakeland and have had very positive experiences with Lakeland in the past. As I mentioned, I've had some knee surgeries that have gone very well. I've had hip surgery, replacement surgery recently, which is a result of my weight loss efforts. I've also had leg surgeries. In fact, I've had a lot of surgeries with the lower part of my body, and mostly, if you think about it, that's because of my weight. And I needed to do something, and Lakeland decided to bring bariatric as an option, and so I decided I had to try it out. I think in the end, the secret to my success has been learning how to change how I treat food. You know, I grew up and I was one of 5 boys, and we would eat dinner together, and if you didn't eat your dinner pretty fast, your brother would eat it next to you. And so I learned to eat really fast, and which means also not chewing very well. And that's one of the things that I've had to change in my life, is I have learned to eat slower and to chew it all completely. Now, I used to eat 3 meals a day, and I used to eat snacks and so forth and that sort of thing, just like everybody. But I was gulping it and eating it way too fast. That's what's changed. I don't eat 3 square meals a day because I don't really need it. What I do is I eat the foods that I like in small amounts multiple times during the day, and that causes me to lose weight. You know, my life and my health has changed dramatically since my surgery. Just prior to the surgery, I was taking medication for the gastric acid reflux, I was taking pre-diabetic medicine, I was taking blood pressure medicine, I was taking pain medicine, and I had a list, a whole little case full of stuff. Many people can probably relate to that. And as I started in the process, I was told that once I had this surgery, I would take no medicines. And I was a little nervous about that, but I was game for it. And so I took the surgery and I stopped taking those medications the next day. I've been continued to be checked. I'm no longer pre-diabetic. I don't have high blood pressure, and I don't have pain in my joints anymore. Since I started the process with Dr. Mike, officially since my operation, which is about a year ago, I'm at about 93 pounds lost on the record there. But I kind of started that process before that. I knew I was going to do this, and it took a while to get that approved and get it worked out. So actually my total weight loss is just over 120 pounds right now. Pretty good. My ultimate goal for weight loss is to lose about another 70, maybe another 80 more pounds. Really, it's not necessarily poundage that I'm after, it's an image that I'm after. I was in the Air Force when I was young, and I had a lot of fun. And I used to wear a flight suit, and you know what? I'm gonna wear one of those flight suits again someday. I don't have that one, but I'll get one. You know, the secret to my success has been the fact that I realized I had to do something, and I found a group of people who realized that I could do something. You know, they had a belief in me. They also had a tool that I could use. They gave me the tool, physical tool inside my stomach, and then they gave me the mental tools, how to change how I eat, how to change how fast I eat. And those two things, changing how I eat and how I eat it, meaning to chew it a lot more and eat slower, has made a huge difference. I've not given up any single food. I just have given up how I eat them, and I continue to lose weight. You know, if I had the chance to talk to somebody who was thinking the idea over and maybe they weren't sure about it, I'd tell them to do it. And I'd tell them, don't worry about what other people say. You know you best. And inside you, you know you got a problem that you can't manage, and it's time to do something about it. Don't listen to what they're saying. This is a proven method. I'm a proof of that method. I've lost weight continuously for 12 straight months. That never happened before when I've dieted. But it's happening now, and it's still going to continue happening. So just be you, listen to you, don't listen to the others.